researchers studying how asymptomatic people spread the virus in our area. And WBZ's Christina Hager shows us what he's found.
Franklin Police.
Dr. Gregory Chiklis shows us bags full of COVID-19 antibody test results in his Franklin lab. Hundreds he ran on police and firefighters and others from towns west of Boston. This one
It's a very strong positive.
is among the 4% of the positives that had zero symptoms.
We've gone back now and tested their spouses or their partners. In a couple of cases, we've tested their children who are over 18. And in no cases have we seen that person spread the virus to their other family members.
It echoes the World Health Organization's declaration this week.
It still appears to be rare that an asymptomatic individual actually transmits onward.
But one day later, that doctor is now dialing back.
And that's a big open question, and that remains an open question.
And Governor Charlie Baker now says he's skeptical.
People who are asymptomatic, who become symptomatic, are absolutely capable of spreading the infection, and so are many of the asymptomatic people who never show symptoms at all.
So they'll come in once every couple of weeks and they'll donate a unit of plasma.
Dr. Chiklis says it's still early, but the more tests he runs, the more confident he is.
What we're learning about this virus is it's more about identifying who has symptoms and who is sick, so we can identify those folks, we can contact trace with those folks, and we can keep them from getting other people sick.
When Chiklis went back to retest those who were positive, he found more interesting information. He says their antibody levels had gone up, indicating their immunity may be getting even stronger. In Franklin, Christina Hager, WBZ News.
Wow, that is interesting. Christina, thank you.